Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The World Health Organization on Wednesday said coronavirus infections rose by 8% last week to more than 3.8 million. Latest data from the UN Health Agency showed a substantial uptick in the Americas and the Western Pacific, which jumped 30% and 25% respectively. This contributed to a sharp rise in the number of coronavirus deaths overall, which climbed by 21% compared with last week to more than 69,000. And the Nigerian Minister of Health, Dr. Sage Hanure, says over 18.2 million Nigerians are infected with viral hepatitis in the country. He said that awareness, reporting, diagnosis and treatment of hepatitis B and C remains low in Nigeria. The minister, who was speaking in Abuja, said that hepatitis remains a disease of public health importance and the mortality rate from both infections was still alarming, despite limited globally progress in addressing the scourge. And the federal government is set to release 36 billion naira to states as part of measures to curb the rising COVID-19 cases and prevent the third wave of the virus. This came to the fore as the country recorded 404 cases on Tuesday, the highest in the last 1 month. No fewer than 1,276 new COVID-19 cases were recorded in the country between 27th of May and June 27th. But between June 27 and July 27, 4,264 cases were recorded, representing an increase of 2,985, an equivalent of 33.93%. Over 1,276 cases recorded between May 27 and June 27. The Africa Center for Disease Control, CDC, on Wednesday disclosed that the African continent was faced with syndemics, a combination of emerging infectious diseases which are increasing the disease burden across the continent, according to John Nkagasong, Director, Africa, CDC. He stated that from the COVID-19 pandemic, lessons learned and response in the continent's coordination and collaboration is key for a whole of Africa approach, with a critical role for national public health institutes in pandemic preparedness and response. A long-running British study has shown that about 1 in 3 middle-aged people has multiple chronic health issues. The 1970 British cohort study has been periodically tracking the lives of about 17,000 people born in England, Scotland and Wales in the single week. Nearly 8,000 of them were surveyed for the University College London work published in Journal of BMC Public Health, and 34% had 2 or more chronic health problems such as high blood pressure and mental health sicknesses at age 46 to 48. And this is TOS Television Network and you're watching Health 54. Welcome back. Worried about the spread of the infection and its current rampaging consequences on the global health system, the World Health Organization launched the first global strategy on hepatitis in 2016. The strategy, among other efforts, aims to eliminate hepatitis as a public health threat by 2030. Also in February of 2020, African heads of states and governments, including Nigeria's, pledged their commitment to the Cairo Declaration, which resolved to address viral hepatitis as a public health threat. But in Nigeria, with an estimated 12% of the country's roughly 200 million population currently down with chronic hepatitis B and 2% of the population battling chronic hepatitis C, there seems to be no sign of the country's commitment towards ending the disease burden by 2030. Real Madrid's new defender, David Alaba, has tested positive for COVID-19. the Spanish top club said on Wednesday. The Austria international Alaba, 29, will not have to quarantine shortly after he arrives in Madrid on a free transfer from Bayern Munich. Alaba won all club titles on offer over more than a decade in Munich, signed a 5-year contract at Rio. A new study has confirmed that the AstraZeneca COVID-19 vaccine carries a small risk of rare blood clots with low platelets after the first dose. According to the study led and funded by AstraZeneca, the vaccine, however, has no extra risk of blood clots after the second dose. As reported by Reuters on Wednesday, the study already published in the Lancet Medical Journal found that the estimated rate of thrombosis with thrombocytopenia syndrome after the first dose was 8.1 million in those inoculated. The novel coronavirus has killed at least 4,179,675 people since the outbreak emerged in China in December of 2019. According to a tally from official, at least 195,244,860 cases of coronavirus have been registered. The vast majority have recovered, though some have continued to experience symptoms weeks or even months later. The figures are based on daily reports provided by health authorities in each country. And finally, before we go, Plateau State has recorded a new outbreak of cholera in the Lantang South local government area, bringing the total of the local governments affected by the disease to 14. The Commissioner for Health, Dr. Ninkong La, on Tuesday added that death toll had moved to 24 from 21 recorded last week. He also said the total number of cases had risen to 1,315 from the 1,144 recorded last week, while 1,279 patients had been discharged from the hospital. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching. Thank you.